topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Los Angeles. Welcome to another Ask the Expert show, where for the last 16 years, we have been bringing you the top experts in the field of legal, health, financial, and home improvement. Hey, let me tell you something. If you are a chiropractor, if you are a podiatrist, you don't want to miss today's show. We are going to be talking about neuropathy, but our excellent guest has created something that hopefully doctors across the country are want to get involved with. Let me introduce you to our great guest, Dr. Jason Kelberman of the West Side Wellness Center. Good afternoon.
Good afternoon.
I got to tell you, this is so exciting what you have come up with. And, it's, I'm going to let you tell everybody about it. But first, before we do that, because it's called the Foot Power Rehab System. But before we do that, Dr. Kelberman, you've got this great practice. Tell people about it.
So, gosh, the practice we have now in West LA is really the accumulation of 40 years of helping people become pain-free. And the longer you're in that process, the more you learn and the more we discover as we go. And peripheral neuropathy, the words mean the ends of the nerves, okay? So usually it's feet, but frequently it's hands. And it means that the nerves are degenerating. And when a nerve degenerates, it sends off weird, unusual sensory things. So pain is only one of them. Numbness, tingling. People say, oh, I've got ants crawling on my skin. It's cold, it's hot. It doesn't function the way that it should. What that basically means is you have an electrical receptor in your feet that is not communicating well to your brain. And it's being interpreted as pain, burning, cramping, numbness, tingling, etc. Which, if you've ever experienced that, it's quite hard on your whole being. I mean, a lot of these people can't sleep, can't walk, and it just takes over their life. And it's happening more and more in America and in our elderly, but increasingly in our young people. Thank you, diabetes. And we can have an hour conversation about why we're seeing it more now than ever before. And perhaps we should. I don't know if we can cram it into this short show or not. But basically, everything that affects the circulatory system and into the smaller capillaries, which are tiny, tiny, tiny vessels that then feed the nerves. I'll give you an idea how tiny. Only one blood cell can fit through there. You know how small that is? Yeah. So imagine that those tiny vessels start to get clogged and things don't move. So then oxygen doesn't flow to the distribution of that capillary bed and the nerve and or whatever else it's supplying. And so the lack of oxygen is called hypoxia. So things start to lose oxygen. Everything in our body loves oxygen. We can't live without it. It's mandatory. So things start to lose oxygen and die off, and that's basically what's happening from a lot of different reasons. And in the medical world, they only have a couple of solutions. I'm not even going to call them solutions. I'm just going to call them medications. Gabapentin and Lyrica are it from a pain perspective. So we're not treating the neuropathy. We're actually just giving you a pain remedy, or basically numbing your brain so it doesn't feel the pain, but doesn't do anything for the neuropathy itself. The only thing that the medical world really has is called intravenous immunoglobulin therapy. And that is only used with a specific type of neuropathy. And if you can imagine, there's a lot of different types of neuropathy and a lot of different ways that you can get it. As many different people there are, that's how many different ways you can get neuropathy. In case anybody's listening and they're thinking, oh, I'm going to go to my neurologist and I'm going to get the immunoglobulin therapy, you have to have CIDP, which stands for chronic inflammatory demyelinating polyneuropathy. Okay, say that 5 times fast, win a Cupid doll. And that's a bit more rare. It really is. In which case your immune system is attacking your nerves directly. And you could kind of categorize that as an autoimmune situation. And I understand the difficulty that the medical world has, people have, I have when we all treat this situation, because the medical world is mandated to give you medication. That's what they do. You don't go to an acupuncturist for a medication. You go to your medical doctor for medication. You don't go to your chiropractor for medication. Okay, it's like that. This is what they do. This is as far as they've gotten with that. And I'm pretty sure in the next 5 to 10 years, you're going to see an explosion in ways of keeping us healthy. Let's just say that my interpretation of America right now is that we treat sickness. We don't teach how to stay well or get well. Okay, they treat basically diseases, and in this disease, there is no cure in the medical world. So enough of that. So over the last 20 years of learning from every doctor who cares to share their experiences and their expertise in America, I've come up with a system that I use. And as a result of that, I saw the need for foot rehabilitation. It frequently is the case whereby neuropathy patients lose their foot function, so they lose their balance and ability to walk. And it's one thing to try to help the nerve recover. It's another thing also to help all the supportive tissue to recover so you can walk again. And that's what I have basically perfected. It's a home system. We use it in the office, but patients can use it at home on a long-term basis to help restore not just muscle function, but blood flow, which equals oxygen, okay, which equals a great home therapy. Yes, there are many home therapies, and if you're online, you're going to probably see oodles of everything ranging from vibration to electric to laser to all kinds of ground. Yeah, lots of things going on there. And so at this point, I have actually applied to the Medicare system for categorizing this piece of equipment, which we call foot power, as a durable medical device and turn it loose to everybody in America, irregardless of what protocol you're using to help your neuropathy. This is the best, by far, foot rehab modality that's ever been, okay? And I'm not just patting myself on the back, but seriously, folks, all the docs I've trained, they tell me the same thing. It works just like I told them it would, and they're all doing great work. So that's kind of where I have been. That's the mainstay of this practice. And there's even more groundbreaking things coming in the next year or two, because things happen slowly in America. In case you hadn't noticed, change happens really slow around here, or all at once. And when it comes to something that changes the way we think and treat, this affects other people, and sometimes it's not well received. In other words, if tomorrow I had a cure for cancer that didn't involve chemotherapy or surgery, okay, there are those that would first poo-poo it just because, and those that would be hit financially as a result of that. So you would see why things happen real slow, because you have to twist a lot of arms along the way and prove a lot of data to make your point. Drugs cause neuropathy, diabetes causes neuropathy, malnutrition causes neuropathy, bad food causes, let me count the ways. And to the degree that you capture what it is for that individual, they get better that much faster. We don't treat people like a cookie cutter thing where everybody gets the same treatment. We try to be as individualized as humanly possible so we get great results. The foot power system. I just published a 1,000-patient study for over the last 10 years that I've been perfecting it. And the current model is amazing. Very happy with it. Really durable. 300, 400-pound people can get on it, can't break it. It still only takes 2 minutes a day to do it. So it's pretty easy to fit into your lifestyle. And what I hope happens to this long term is, okay, let's talk about that for a moment, because even if you don't have neuropathy, as we get older, our feet get more weak, that we stop walking and exercising as much as we used to. And believe it or not, walking is actually not the most strengthening exercise for your feet, because we were designed to be barefoot on soft ground, not stuffed into shoes, only using one particular motion. So I had a long discussion with a podiatric surgeon. By the way, that's on the website now. The new Foot Power website is up. And I'll leave some details on that as well. And he was saying, after using it, that that's probably the best thing that could happen for foot exercise, bringing us into 2025, where for the last 40 years or so, foot rehab was basically put a towel on the ground and try to grip it and pick it up and do that with marbles. And that was the rehab. Okay. Now, 40 years ago, that's all we had. But now, welcome to the digital age, because now we have great foot rehab. So whether it's neuropathy, whether it's other foot issues, whether it's post-surgical without complete resolution, we've helped people with all kinds of different foot problems using the Foot Power system. And so we also set up, because we do a lot of pro bono work here, a free screening for people to get a proper diagnosis, and they can do that by dialing into the office at 310. I see it at the bottom of the screen there, 268-8008, and my front manager Maui will be happy to help you. Just tell her what you're experiencing and what you were thinking, and we'll help you out. Steve-O, I can't hear you. Can you hear me? So I'll keep talking until I get a question from you.
Somehow I got muted. Can you hear me
there
now?
We are.
Okay.
There we are. You're no longer muted. Well, stop using that fat finger on that button. For Christ's sake.
No kidding. I got to tell you, neuropathy is the hottest topic in the country. And I base that on is because we are in a lot of cities and a lot of states I've never seen so much marketing for neuropathy as
Yeah.
I'm seeing now. It is crazy. They're all trying to catch up with you. You've been doing this for a long time, but
Yep.
tell me how the foot power system works.
So let's see if I can get my hands in here. Okay. Pretend this is your foot. Are our viewers going to be able to see, or am I just going to talk it
Yeah,
through?
I can see fine.
Okay. So our foot was
Remember,
meant
we're
to,
on radio too, though.
well, that's what I was trying to figure out. How the hell
Yeah.
do I explain this on radio? Okay. Pretend that you were trying to grip something and pick it up. Okay. That motion is called plantar flexion. Our feet were designed to do that. And when we put in shoes and walk, it does the exact opposite motion and doesn't allow us to plantar flex the bottom of our foot. So the bottom of our foot, all those intrinsic muscles get weak over time. Okay. And then that reflects into the muscles that are outside the foot, the extrinsic muscles. And all of a sudden you have changes going on inside the foot that wouldn't have happened if you didn't wear shoes. But let's be honest, you got to wear shoes or bad things are going to happen, right? Hey, I can attest to that because I actually broke a toe a month and a half ago because I snagged my little toe on something as I was moving too fast barefoot and broke it. So, our feet are fragile as well. So, there's a place for shoes, and then there's a place to use them. So all the people who are out there wanting to go barefoot, I applaud them. I think it's great on sand, on grass, okay, on the beach, wonderful. But on concrete, no, 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 no. Out in the real world, no, 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 no. Okay, that's an international language, by the way. I coined that because we need the protection. We just do. That's the nature of it. So the basic motion of foot power addresses that. And it allows you to progressively strengthen. It's like going into your gym and changing the weights every couple of weeks, okay? You get stronger and stronger and stronger. And while you're getting stronger, you're getting blood flow and oxygen, okay? Like every other part of your body, okay? It's no different. Why do you need to exercise? Because you need blood flow, oxygen, and movement, okay? Same thing in the feet, and yet we just stuff them in shoes and leave them there. So, and that's most of the population. And then pretend that you're now getting older and, you're sitting around more rather than walking more. Now you're getting weaker and weaker and weaker. And the other reality that I noticed is everybody over 50 stops moving sideways because, well, those people who dance or play tennis or do certain things that move them sideways maintain that musculature. And those that don't, that starts to atrophy. So, we're kind of geared to just like going straight ahead. All right. Sometimes I think of myself in the old cars where you could shift. It's like we only have one gear, forward. There's no sideways. There's no backwards. This is how we are. And so we lose a lot of that musculature as we go through life. And we don't notice it because it happens really slow. Okay. And then you wake up one day and you go, gee, my balance is off. I guess I'll have to start holding on to the handrail and go up the stairs. That kind of thing. Slow. Everything happens slow as we age. Speaking of which, here's a tip. If you're doing great and all of a sudden, whammo, you get hit with neuropathy hard and fast like that, that's not a good sign. You need to go to your neurologist instantly, okay? Because that means it's a very aggressive situation. That's probably one of the only negatives. Otherwise, the rest of them just go slow. So you do have time. On the other hand, because it happens slow, a lot of people don't do anything about it, and it just keeps progressing. Once you're in that mode, it just keeps progressing. You got to stop it from progressing and turn it around, okay? And probably the largest portion, I'd hate to say this, but most people who come in are diabetic or pre-diabetic. Pre-diabetes, you would think, God, I'm not even fully diabetic yet. That shouldn't be a problem. The pre-diabetics get neuropathy, okay, at a 50% rate. So don't wait. This is my biggest suggestion. and I think that goes for a lot of things in the medical world. Sometimes just don't wait, get it checked. The longer you wait on some things, the worse it gets. You want to keep things minimal and get rid of them as quick as you can. Because, we're human. We like to accumulate stuff, we get used to it.
We have a couple minutes left. I wanted to,
Yeah.
a lady called me this morning who saw your show was coming on, and she's actually watched 3 of your last shows, but her mother is coming to, I guess, the Malibu area from
Okay.
Boston, and
Yeah.
she's told her mom about you. Her question was, how come medical doctors don't know more about neuropathy?
Good question. Everybody has a box. I'm gonna explain it that way. If my job is to balance your blood sugar as a diabetic, that's what I do. That doesn't mean that I should now. So that might be a GP, that might be an internist, okay? And internists are not people who deal with nerves. So, in the medical world and in most of our society these days, everything is a specialist. So I would not expect an internist or a GP, a family doc to treat neuropathy, unless maybe you're out, in the country where you're the doctor. I think that's kind of the situation where you have to. So you're going to learn it and you're going to figure it out because you want to take care of that person. And that's kind of how I got into it too, because I wanted to help these people who were coming in. And so I worked with a lot of different docs and neurologists, and it just slowly began to make sense. And over the decades, we learned more, and manufacturers created better modalities and equipment to help us, and better nutrition, et cetera. So slowly, we've evolved into that. That's the only explanation I can give you for that, because in the medical world, unless you have a complete scientific, peer-reviewed study on a specific medication for a specific reason, it doesn't happen. And that's not how neuropathy works. Okay? It's different. It's different in everybody. Yeah.
Kind of run out of time here. Tell people, especially ones who are listening on radio or iHeart or Spotify, how they can reach you.
So the office number here is 310-268-8008. That's 268-8008. If they want to go on and look at the Foot Power website, it's basically westsidewellnesscenter.com/foot-power-USA.
Dr. Kelberman will be back again with us next month. Dr. Kelberman, thank you so much. You're the best of what you do. We'll see you next month. That's Dr. Jason Kelberman. We're going to go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.